Hi, I'm Dr. Niharika Allu, Consultant Obstetrician and Gynecologist at Birthright by Rainbow Hospitals, Visakhapatnam. Today we are going to talk about miscarriage. Whenever a woman is pregnant, any pregnancy loss before 20 weeks is called as a miscarriage or a pregnancy loss. So it can happen that when a woman is pregnant, about 10 to 20% of those women may land up in a miscarriage. Usually, the 80% of the miscarriages happen below the 12 weeks of pregnancy. So, to understand miscarriage, we need to understand that when a pregnancy test is positive, especially we need to know whether the pregnancy is in the uterus, outside the uterus, or in the ovaries. So we do a scan to confirm the viability, that is, if the pregnancy is going to go forward or not. So usually to confirm a viability, we have a scan and where we will be able to see a sac in the uterine cavity over which later a baby pole forms and then the baby's heartbeat develops. So usually all these changes take place between 5 to 7 weeks of pregnancy. So we calculate 5 weeks from the last menstrual period of the women. So when we have miscarriages, there can be different types. Sometimes women can have a spontaneous miscarriage where they can actually start bleeding spontaneously and lose the pregnancy. Sometimes the heartbeat can form and then stop, and that is called as a missed abortion. Sometimes the pregnancy is positive on a urine pregnancy test, but we may not be able to pick up on the heartbeat or a baby pole on scan. So these are the different types of miscarriages that can happen, and usually there may be some causes which may be responsible for these. So we have to always rule out any kind of diabetes in a woman, any thyroid dysfunction, anemia before planning a pregnancy itself, and sometimes even genetic problems can cause these miscarriages. Miscarriages after the 12th week of pregnancy, that is in the third month, can be because of some problems in the shape and size of the uterus or in the lower part of the uterus called the cervix. So these are the different causes that can be responsible for a miscarriage. So to prevent yourself from having a miscarriage, you should also have a preconceptional counseling where you rule out all the problems that could be responsible and take nutrition supplements before the planning of the pregnancy itself, and follow up with your gynecologist as soon as your pregnancy test is positive.